All right, the spring session of Nova Scotia's legislature begins March 21st, and that's quite a ways away on the calendar, about a month away or so. But the opposition is already setting priorities. Joining me for a chat is NDP leader Claudia Chender. Claudia, thanks for joining the show. We appreciate your time.
Thanks for having me, Todd.
All right, so I think when it comes to big issues, some of the stuff kind of writes itself, doesn't it? It's not as though you have to dig too deep to kind of figure out what needs priority with healthcare at the top of that list, and perhaps what to do with some of that extra healthcare spending money, which we will have as a result of an infusion from the federal government.
Mm-hmm. Yeah, absolutely. I mean, we know from talking to people right across the province that, you know, a year and a half into this new government, people are as concerned as they've ever been about healthcare, and, you know, frankly, are getting kind of pretty dispirited about it. You know, we hear these terrible stories of what's happening in our ERs. You and I have talked about that. We know that the people who don't have access to any family care is growing and growing, and we're seeing great initiatives in other provinces that are trying to deal with that. But meanwhile, nothing's really seeming to move the needle here. So
what are some of these other great initiatives you're talking about in other provinces?
Well, Todd, when I talk to folks, you know, what I hear the most often, people have all kinds of issues with the healthcare system, is that they just want a family doctor, and particularly families with young children and seniors. They want to know that if they have a healthcare issue, they can get it dealt with. And so we have seen in BC a massive reshaping of what family medicine looks like, so that there are, you know, really public clinics that are available to the entire population. You and I have talked about this before. You know, our focus is really on providing primary care to everyone in Nova Scotia. And so in Prince Edward Island, in just a matter of a few months, they've promised to open, you know, family health homes for all islanders. They're opening 14 across the province. You know, in Alberta, there's big conversations about this happening in the election that they're going into. The Alberta NDP is pledging to do the same. So I think it's really, it's common sense, and it's really hard work.
What's a family health home? What's a family health home?
I think it's what we would call a collaborative practice.
Okay.
So I think the idea is that, you know, it might not be that every Nova Scotian actually always has access to a doctor when they need it, but that their file, we've been talking a lot about files, right? One patient, one record.
Yep.
People want to know that there is a place that they call if they don't feel well. And then they go there. And then, you know, if their kid has, you know, a fever that is really stubborn and won't break, or if a senior has a chronic infection, which happens a lot, like a UTI or something like that, that they can have their health tracked. And so in those clinics, and we have examples of them right here in Nova Scotia, at Dow Family Medicine, at the North End Community Health Center, on the North Shore, there's a collaborative clinic where you have a doctor, but you might also have a nurse practitioner or a physiotherapist or a social worker or a physician's assistant or a pharmacist. And so depending on what your issue is, you can have that dealt with. And it makes a lot of sense, and it's what people need. They need to be able to deal with their health issues when they arise, so that they don't end up having to go to, and in many cases, leave an ER before it's dealt with because of the massive pressure on our healthcare system.
So we are doing that here in Nova Scotia to a degree then.
Well, we have examples of it here in Nova Scotia, but there has been no concerted effort to roll that out across the province, which, as I say, would be a seismic shift in the way that we deliver healthcare. But I think it's one whose time has come based on the healthcare resources we have and the population and our population needs. We, you know, as we know, Todd, we've got a lot of seniors in our province. You know, they've paid their dues, and now we need to take care of them. And we have a lot of kids in this province. We have a lot of in-migration, and we need people to understand that when they come here, they're going to be able to access healthcare. And right now, they don't know if they're going to be able to do that. And you know, they shouldn't also have to, in any case, pay for it. And so we believe that this is the solution that will start to really move the needle on all of the various healthcare issues that we see in our province and that people are experiencing. You know, we had a constituent who said he took his kid to 4 walk-in clinics and the IWK before he could, you know, get a really stubborn infection diagnosed last year. That shouldn't be the situation. those walk-in clinics were full. They wouldn't even take an appointment.
All right, so the walk-in clinics that we do have are full, can't take appointments. How do we then expand on this and roll this out into a larger scale if we're having a challenge staffing the small levels that we do have?
Yeah, so I think what we're talking about is a complete change in the way that we deliver primary care. As I said, we have examples of it, but we take, instead of physician staffing walk-in clinics where your chart isn't there, you get one-time help, or virtual care where, again, you get one-time help. We actually reorganize the existing staff we have. We pay them enough that they want to stay here. We focus on retention, which is another thing we haven't heard enough from this government about. How do we retain the nurses and the physicians that we already have? Because that is crucial to delivering health care. And we make sure that all professionals actually work to their scope so that in our health practices, people aren't lined up out the door waiting for the single physician, but that they can see a nurse practitioner if that's all they need, or they can see a pharmacist if that's all they need, or they could speak with a social worker if that's what they need. And so it's much more efficient because people get the health care they need when they need it.
Well, when it comes to expanding scope, though, this government has done that. I mean, with pharmacists and other areas, it has expanded scope, has it not? Do they get some credit for that?
Yes, sure. But the reality is that if you go to a pharmacy clinic, most of which are owned by Loblaws or Sobeys, number one, that certainly helps the bottom line of those big corporations. But number two, you may go there because your kid has strep throat, and it's great. The pharmacist can diagnose that and deliver care. And so right now, when we're in this crisis, that's really important. But then when they leave, no one has a record of that having happened. No one knows what antibiotic that child has been on. If that reoccurs in a week, that person doesn't keep your chart. So it's a stopgap, and it's a good one, and it's important, but it doesn't fix the systemic problems we have. But, it's not just healthcare. I think when we go into the session, we're also going to look at the cost of living. And, how is this government actually actively addressing the challenges that Nova Scotians are having, just paying the bills and affording rent? We have the cap on rent that's due to come off this year. People are terrified about that. And so, budgets are priorities, and we'll really be looking for this government to be addressing the priorities of the people of the province in the way that we're hearing them.
Just quickly, would you extend the rent cap if you were the premier?
No, what we have always argued for prior to the introduction of a rent cap is a comprehensive system of rent controls that make sense for everyone in the rental market. So I think there was a conservative commentator recently who said, well, when you lift it, you should raise it by 1% the first year and then 1% more the next year. That's rent control. And it's a scary word, but it actually makes much more sense for tenants, for landlords, and for our entire housing market to have a sensible system where you know how much the rent can increase, you know when that increase will happen, you can apply to have greater increases or to do renovations, but that we actually reform residential tenancies so that we have a system that actually can accommodate all of the people who need housing in our province, and so that people aren't constantly being priced out of the market. So that's what we've always suggested. We have legislation on the books suggesting that. And I really believe, Todd, that it's our only way out of the rent cap. Okay. Because if you talk to anyone who works in housing, they will say, if that rent cap comes off, there are hundreds and hundreds of people across this province who are immediately going to be homeless. And I don't think anyone wants that. And so the question is, so what do we do? And we have a very sensible solution, one that we've been suggesting for years, and I think it's a suggestion whose time has come.
Okay. Claudia, I appreciate your time. We'll talk soon.
Okay, thanks so much, Todd.
All right, take care. NDP leader Claudia Chender. House Calls with Dr. John Gillis when we come back.